Hi, my name is Tanya Bowen. This presentation is on mental health suicide. Introduction. Mental health is a crucial aspect of health and wellness in a community. Mental health conditions are prevalent among young people. Failure to address mental health issues can result in their persistence into adulthood. Suicide is among the most common mental health issue. This presentation focuses on suicide and prevention. The rationale for choosing suicide is that I have a family history of suicide and also lost colleagues to suicide. Additionally, suicide has a great impact on youth who are the future generation of a nation. Objective: to define suicide, to identify the mode of suicide, to determine the risk and preventative factors of suicide, to to identify warning signs of suicide, to identify high risk group, to discuss the psychological and mental implication of suicide, to discuss possible solution to prevent suicide. Suicide and its prevalent. Suicide refers to death caused by self-directed injurious behavior with the intent to die. People who attempt suicide self-inflict injury using non-fatal method. Statistics. Suicide is the third leading cause of death for people aged 15 to 29. More than 700,000 people die due to suicide every year. There were around 28 suicides per 100,000 white male in the United States in the year 2021. Suicide rate for non-Hispanic white range between 2 to 3 times higher than for non-Hispanic Black and Hispanic people. There were 43 suicides per 100,000 male among American Indian or Alaska Native in 2021. Age-adjusted suicide rate increased between 2000 and 2020 for non-Hispanic 7.8 and Hispanic 7.5 people. Mode of suicide. Drug overdose, both prescription and non-prescription drug. Poison with insecticides. Physical harm such as jumping off a building. Hybrid self-harm with herbs such as knives. Strangulation, self-hanging, intentional car accident, firearm, suicide. Risk factor for suicide. Prior attempts to suicide. Family history of suicide, substance abuse overdose, mental disorders such as PTSD, anxiety, and depression. High risk group: youth, people live below poverty level, bereaved people, people diagnosed with other mental disorders such as PTSD, anxiety, and depression, people dealing with trauma such as survivor of domestic violence, sexual assault victims, minority populations such as people who identify as a member of the LGBTQIA community. Warning sign for suicide. Suicide, suicide ideation, direct statements such as threat to end one's life, constant talking about suicide plan, suicide attempts, isolation, reckless behavior such as driving under the influence, overspeeding, psychological and mental implication for suicide. Suicide affects families, community, and the entire nation. Family members face long-lasting effects such as depression risk due to the prolonged grieving their deceased loved one. Survivor of suicidal attempt can sustain permanent disability, increased dependency rate. Possible suicidal prevention solution. Suicide are preventable with effective intervention such as restrict access to more lethal suicide methods such as firearm, cognitive behavioral therapy, suicide prevention training among community members, focus on high risk group among health care provider, focus on low focus on how to treat people with suicide attempts with caution. Avoid discriminating the LGBTQIA members. Provide emotional support. Create public awareness about suicide. Create awareness about the availability of suicidal prevention services. Debunk stigma and taboo. These strategies can encourage seeking medical help. Summary: suicide is a growing concern in our current generation. Prevention of suicide is an essential community initiative. Evidence-based interventions such as safety practices restricting access to lethal suicide mode such as firearm can help reduce the rate of suicide. Continuous monitoring and surveillance of suicide incidents can help form policy. Healthcare providers such should strive to promote mental health among youth and other health high risk groups.